Hey everybody, good afternoon and welcome to this Caregiver Coffee. My name is Matthew Estrad. I am a gerontologist in St. Tammany Parish, Louisiana, and making videos and education for the Council on Aging in St. Tammany for about 5 years, and I've also been the caregiver support group facilitator just about every week of the year since 2015. We started this Caregiver Coffee, as you know, through when the pandemic started, and we've just continued it because we want to get as much education out to aging adults, older adults, caregivers, etc., as possible. So today we're going to continue with the four M's, and we're going to talk about medication. Now, a a quick summary or a reminder of the four M's. The four M's are a framework to look at care, and it's something that doctors and nurses should look at, and it's something that patients should look at also. So if you are watching this, you are someone who is informed about the four M's, and you can bring this to your doctor and kind of look at things as that through that framework. The four M's are what matters, medications, mentation or mind, and mobility. And they all work together, they all interact together. You change one thing, it's going to impact the other. So previous to this video, we talked about what matters or what matters most. So now we're going to medications and we'll have some videos about medications. And then after that, we're going to move on to mentation or mind, where we talk about cognition and mood. So I'm really excited about medications. They're so important because they impact every day of our lives. Actually, all of these do, right? They all interact with each other. They're all very impactful for our lives. Medications, because they could impact our mobility, our way to move around, our mentation, how we think, if we think clearly, if we have our medications optimized, then that does good things for our mobility and our mentation for what matters. If they're not, it could cause us to feel not as well as we could cause us to feel cloudy, and we'll talk more about that. And it contribute to falls and other things like that. So let's get into medications. But actually, before we do, just a quick plug for the caregiver support group that I facilitate. So we basically meet every Tuesday of the year, unless that Tuesday is Mardi Gras Tuesday or Christmas falls on a Tuesday, and in which case most of those times we don't cancel, we just move to later in the week. So that's why it's important that when you are looking for information about the support group that both meets both in person and virtually, that you go to the Council on St. Tammany's website, and Council on Aging in St. Tammany's website, that you go to caregiver resources and you find the flyer that we publish every 2 months, because that will tell you if there is a holiday and where we move it to, and it would also tell you what location we're going to be at when we're in person, as well as the dial-in or the login information for the Zooms when we meet virtually. So, and all of these meetings are free. They always have been free. They sponsor me to be there. So please consider joining us if you're a caregiver, taking care of someone, taking care of an older adult. All right, with that housekeeping out of the way, we're going to dive into this article by the NIH. That the NIH is the National Institutes for Health, and specifically, this is the NIA, National Institutes on Aging, and they have many great articles on their website having to do with health. They're called Health Topics A through Z. And the title of this one is Taking Medications Safely as You Age. So, as usual, when I find and follow a good article, I'm not going to be reading the whole thing. I'm going to be hitting some highlights typically and encouraging you to go to that article so that you can read more into it, so you can read it again, so you can underline it, put it in your files. You can also share it when you have that link, which I hope that you will do. Because as you can see, as you will know, As you will know by the end of this video, it's pretty valuable information. It has nothing to do with me, but it's the good information here. So, and we're going to talk about medication over a bunch of videos. So we're not going to rush through it. There's just lots to cover. So we'll just look for more videos as we go. All right, so diving into the second M, medication. The article again is called Taking Medications Safely as You Age. So medicines are intended to help us to live longer and healthier, but taking medicines the wrong way or mixing certain medications and supplements can be very dangerous. Older adults often have multiple medical conditions that may mean taking many medications, and this puts older adults at additional risk for negative side effects as they interact. Read on or listen on, watch on to learn how to safely take and keep track of your medicines. So, what are medicines? They're often referred to as drugs, and they're used to prevent or treat diseases and other health conditions. They can be obtained by prescription or OTC or over the counter. Prescriptions are medicines that you can get with a doctor's order. For example, this would be pills to lower cholesterol, or even an asthma inhaler is a prescription. You can't just buy it off the shelf. OTC medications can be purchased without a prescription, and this can be aspirin, allergy medicines, or lubricating eye drops. Now, dietary supplements are not considered drugs because they are not intended to prevent or treat diseases, and rather these are intended to maintain or improve health, and they may meet your daily requirements of vitamins and minerals, maybe. So there's actually another NIA article specifically on dietary supplements for older adults. So when you go to this article, to the link of this article, you'll see a link to that one on dietary supplements. Now, it can be dangerous to combine prescription drugs, over-the-counter medications, and dietary supplements and other remedies. So you should not take aspirin, for example, if you take warfarin for heart problems. And to avoid serious issues, this is why we always encourage you, why the article encourages you to talk with your doctor or your pharmacist about any other medications you might be taking, whether they be vitamins, whether they are over the counter, whether they're supplements, anything like that. You want to let them know and not be embarrassed about it. Just walk in with all your medications. They call that like a brown bag visit, and that should be at every visit. You should bring all your medications with you in a small grocery bag or a brown paper bag to every visit, because at every visit you should be discussing um, or have the opportunity to discuss uh, medications. And a quick review is typically what's done every time for an older adult. They'll typically say, "Oh, you're taking these medications. Is there anything missing from here? Is there anything else supplement wise?" So hopefully they're asking about that if you don't think about it. So starting a new medicine can be complex. You want to talk with your healthcare provider. And so that's your doctor, that's your nurse practitioner, or even sometimes it's a nurse that is having that initial medication reconciliation conversation in the doctor's visit. But you want to talk with them before you start any new prescription, over the counter, any supplement, or anything like that. Because they know everything that you're taking and they know the drug interactions. You want to be able to discuss allergies or problems that you have experience with medications, and these side effects could be or allergies could be rashes, could be trouble breathing, it could be indigestion, dizziness, or other things like that. And you want to make sure that your doctor has an up-to-date list of your allergies so that they don't give you a medication that contains something that's going to give you an allergic reaction. And hopefully your physician is asking you about any new drugs in addition to what they read out to you and ask you about new allergies and things like that. I know they ask me, and many times they're going from a screen, they're going through certain questions that they ask you. You also want to find out whether you need to change or stop taking any of your medications. And that's your prescriptions or over the counter supplements while taking a new medication that they're wanting to give you or that you're requesting. Mixing a new drug in medicines or supplements that you're already taking might be unpleasant, and it might cause serious problems. For example, mixing a drug that you take to sleep, like a sedative, and a drug that helps you with allergies, such as an antihistamine, can slow your reactions and make your driving of a vehicle or operating machinery very dangerous. I should say, also, I didn't say it before, so I'll say it now. Um, so we're reading from an article, and you know that articles are not a substitute for a physician's or medical providers' advice, real-time advice for your particular and unique and special situation. So just make sure that you're not taking this as medical advice, because we're informing and we're asking you to go back to this article and also work with your doctor. When starting a new medication, be sure to write down the name of the drug, the dose, why it's being prescribed to you. So these are things that we want to know. For many drugs, a lot of this information is on the prescription label. And if you're like me, when you receive a prescription, even a refill, it's got a small booklet with it. So a lot of that information will be on there as well if it's too small. Many times it's too small for me, written on the or printed on the bottle. So here are some questions that you want to ask your doctor about a new medication that they're prescribing. What is the name of the medicine? Why am I taking it? Is there a less expensive alternative? What medical condition does this treat? When should I be expected? When should I expect the medication to start working? And how will I know when it is working? What types of side effects might I expect? What did they see in their patients? Because medications might have a bunch of side effects, but some of them might be very minimal, or they may not happen to many people. So perhaps I would follow up with what's their experience with all of their like overall with their other patients. What is their experience? Will this drug cause a problem if I'm taking other prescriptions or over the counter or supplements? What should I do if I stop taking this medication? Is it okay to stop abruptly? Because and that's a good question because many of them, they must be tapered off and taking a small dose or smaller dose as you go before you stop taking it. And that's that tapering is at the direction of the doctor. So that's why you're asking, but you're also going to let them know if you want to stop taking the medication. Will I need a refill? And if so, will I need a follow-up appointment or other testing before I can take the medication? So that's important because so for instance, I take a prescription medication, and at the beginning of the year, or not the beginning of the year, but after the annual visit, they will write me basically 4 prescriptions. Each of them are for 3 months because it's daily. So I know that I don't have to come back for that particular prescription to get a refill. I see how many I have available. So that's important to know, especially because we want to all be prepared. Being in Louisiana or wherever you are, there are natural disasters. So you want to stay ahead of having your prescriptions filled and always have a good supply ahead of you, getting refills as soon as it makes sense to have. You don't want to have a ton of medications that may not be that might go bad or be, eventually be old, but you want to have enough in case there's any kind of abruption in the system or some kind of weather event or anything like that. All right, questions that the NIA suggests that you ask your pharmacist. Is it safe for me to drive while taking this medication? Should I take medication? Should I take the medication with food or not? I take a medication where I cannot be, it's first thing in the morning and it's before breakfast or coffee or anything like that. And it does make a difference. I feel the difference. It's a lot more effective. So that's why they have these important instructions. How much of the medicine should I take? That's usually pretty obvious, but you want to make sure that you understand. Are you taking just 1 time a day? Or are you doing it 4 times a day? And if so, is that within 24 hours or 4 times that you're awake in those 12 to 18 hours? if I forget to take my medicine, what should I do? They may say, we'll double up the next time, or they might say, don't worry about it. It's good. It's better to just, if you forget, just wait for the next time you're taking it. So lots of good information here at this link. Filling your prescription. When you get your prescription filled, the pharmacist can answer questions, and typically they'll ask you if you want a consultation. Many times you even have to sign that you were offered the opportunity to meet with a pharmacist about the medications. Just depends on the pharmacy and current guidelines for in the state or for that organization. Um, when you have it filled, ask your pharmacist if there's a patient profile so the pharmacy is aware of all the other drugs and over-the-counter medications, vitamins, and supplements that you take. That's a great idea. Tell the pharmacist if you have trouble swallowing pills, there might be a liquid that you can take. Be sure to not chew, break, or crush tablets without asking first, because this will change the way that the drug works in your body, in your system, and how it's released and all that. Make sure that you can read and understand the name of the medications as well as the directions on the color-coded warning stickers on the bottle. If the label is hard to read, ask your pharmacist to use a larger type, either on the bottle and or on the instructions that they give you. Read all of the information carefully. They come with medication guides. That's what I mentioned to you, the printout or the little booklet that comes out with medications. Check to make sure that you can open that pill box or container or pack. Ask about special instructions on where to store the medicine. For example, should it be kept in the refrigerator or other climate controlled place? Check the label on your medicine before leaving the pharmacy. It should have your name on it. It should have the directions provided by your doctor. If it does not, take it back and talk with your pharmacist to make sure you get it. In this article, and this will be the last thing we talk about here, and we'll pick up in the next video, is that there's an image in the video, and it explains it's a medication label that you'll see on the typical bottles, and it will have the information as typically seen. So that's the name of the pharmacy, the address, the phone number, a phone, and if not, they at least have a phone number for refills, the prescription number, patient's name and address, how to take it, such as 1 capsule daily by mouth, number of refills that are remaining, and the quantity of the medications that are in there. So 30 pills, 30 pills, 60 pills, 90, etc. Whatever it is, it should say that on that label how many medications are being dispensed at that time. And actually, finally, a discard. Typically, they'll have a discard after date. So that's a date when they deem it's no longer effective. You want to make sure that you talk with your doctor if you have questions about the written information that comes with your prescription. That means talking with the pharmacist right there, excuse me, calling the pharmacy, or getting a note or message or portal message to your physician for them to answer that. So I hope this has been really helpful. I know I find these to be good reminders for me. So these might be reminders for you. They might be new information, but I hope that they were very helpful. And even if it is a reminder, I think these reminders are very important. It's just because obviously the nature of it being medications and how they impact our bodies, and as we age, we take more and more of them. So anyway, I hope this is helpful for you. I look forward to future videos discussing the 4Ms. We will continue talking about medications, and the next one will pick up where we left off. And I thank you for your attention. Please, if you like this, like the video, like the Facebook post or Instagram, wherever you're seeing this, and be sure to share it with others. And as a final reminder, we will have a link to we have a link to this article in the description, so you can go to it and print it out, and you can just review it and go over it with a fine-tooth comb for all this great information. So thanks again for being here with this Caregiver Coffee and supporting the Council on Aging in St. Tammany. See you next time.